We'll set it up for the next one. Is that okay?
We can't do Instagram.
It's okay. All right. And then whenever you want to go to the next slide, I'll try to. You can just say it, and then I will
So
say
you're
it.
doing it from your.
Yes. If you want, I can leave it here for you, though.
Yeah.
Yes.
Let's do
Okay.
that. Let's do
That
that.
way it's a little
Sometimes we
easier.
could do both. Okay.
So you have two laptops.
Oh, Lord. Now we're live on YouTube here as well.
This is for you.
This can move it forward.
I'm not sure.
Okay.
It's worth a shot.
Hi, everyone. Okay. Now we are live, both online and in person. Sorry for the issues with we're currently in hybrid mode. Oh shoot, let me lower this so I can't hear myself talking right now here too. Hopefully on the other end you can hear me. Please let me know if you cannot hear me, but the microphone should be there. Okay. So what I'd like to do is on the other end, you can hear me. There's a lag. Can you figure out on the audio on this? So thank you so much for attending. I know that this has been hard the last 2 years. We've literally been doing everything remotely, video. The last 2 were Zoom calls, and even the last one was mostly just online. And I realized this last meeting I went to in Washington, D.C. for our academy, we were finally without masks. And it was so nice to meet people in person again and see people again. Even if we were with masks or without masks, just the thought of being able to see people was very helpful, because I was able to learn so much more from my colleagues, to be able to talk to them after the talks in person. And that's not something you can do when you're trying to do something via video. Answering questions is so hard too as well. So thank you for attending tonight. And what I'm going to try to do today is kind of give you some notes from what I've learned from doing lots of facelifts early on in my career. I would say, I talked about Botox, I talked about skincare, I talked about, other non-surgical items, because that was something that people wanted to know. The more I operated, the more I realized there's good and bad about non-surgical procedures. And so that's what I want to teach for you guys today, because there is something to be said about doing things in moderation, everything in life, but so much so also with non-surgical procedures, because we have to be aware of how we're aging and what treatments are going to help us in the aging process, but not deter us from having surgery down the line. So fillers have to be placed in the appropriate place. Non-surgical procedures need to be done superficially, not going too deep. So some of this stuff I'm going to talk about in this talk. So hopefully you learn a lot from me. And then we're also going to go over some prizes at the end that I think that you'll all love to hear about. Okay, so let's start off. This is our first hybrid event, and I do want to introduce Jocelyn. If you've not met Jocelyn yet, Jocelyn Lamb, she's my nurse practitioner. She helps me in the operating room, helps me with the surgeries, but because of that, she's intimately aware of the anatomy of the face. Susan as well, she's helped me in surgeries for 5 years now, and so she also is very aware of the anatomy of the face. So when we see fillers in the face, we both see it under the skin. So it's like peeling the hood and we can see where it's placed. So that's why I'm going to tell you right now today about what I've learned and where it should be appropriately placed. So this is a list of our annual promotions for this year, for 2022. I'll go over in these details, but of course, anything that I'm talking about with you here today, these treatments are what I recommend for before surgery, and then I'm going to talk to you specifically about after surgery. This is our website, so you could visit if you're online and you're not able to attend. This is our website. You can find the same packages that are available here today online, and the shop will close midnight on Monday morning. So midnight around Sunday into Monday, that's when it'll end. We have free virtual consultations tomorrow. So whoever's online can't make it here, we could talk to you online. And we can make those appointments at the end of the night. So if you need to call or you need to send a message through the chat, then we can respond to you and make you an appointment for tomorrow. But tonight, we're also going to put in a little slot for everybody to be able to spend some time either with myself, Jocelyn, or Susan to discuss any of these packages, because sometimes it gets confusing what we're offering here today. All right. And then all of the money that's being got from the promotions, you're getting a raffle ticket for attending tonight. So same thing is for the people online. They're getting one raffle ticket for online. And then afterwards, when you're purchasing any of the packages, every $100 gives you a ticket towards the raffles. And so there'll be all these prizes that I'll announce at the end, and it goes into one pool, and we'll be pulling it on Monday, and we'll be announcing it live on Instagram. So if you're not on social media, now's the time to join. All right. So this is my guide. Now, this is my personal opinion only. Don't take this as, you know, what maybe a dermatologist might recommend, or what a body plastic surgeon might recommend. I'm specifically talking about the face. Okay. And this is from my recommendations based on my experience in the face. I do want to talk about how you could see this aging progression in these patients, for starting from child all the way 20s, 30s, 50s, 60s. And then how do we stop it so we get to somebody like Cher? I mean, she's 70. How does she look so good? So I'm going to give you some pointers today about how do you maintain that. She started early though. That's something that you guys have to be aware of. Genetics is one part of it, but also starting early and maintaining that. So today I'm going to talk about the aging process. I'm going to talk about the 3 layers of aging that we can have an effect on. I'll tell you what I see in surgery. Then I'll talk about how do you tackle aging if you're not ready for surgery. And then for those who've had surgery, how should you maintain the results after surgery? Because aging never stops, unfortunately. So what happens as we age? So as we age, we have lines that start to show up early on. Those are the wrinkles. That's the skin surface. As we start to go further on, volume loss happens, and then sagging happens. And so those structures in the face, we have to address all of them separately. So changes in your skin happen first. These are the wrinkles that start to show up in our 40s. And in our 50s, you get more folds rather than just wrinkles. And that's because of laxity. So there's an important role of collagen that plays a role in all layers, not just the skin, but also in the soft tissue and then down into the muscle. So from the skin all the way down in the muscle, there's attachments that I'll mention later that are built from collagen. So it's important that we know that. There's also changes in the fat. So that means that, I hope you guys can see this, changes in fat, there's volume loss because the fat descends in certain areas. So we lose fat in our cheeks, we lose fat in the upper part of the face, and it descends to the lower face. But we also lose the amount of fat. So not just the fat descending, but it also loses volume as well. So we get volume loss. And that's why we start seeing the sagging in our jowls. We start seeing laxity in the neck too. And we start seeing loss of volume in the upper face. And we have this heavy lower face. We also get changes in the muscle. So this is what I'm tackling when I'm addressing a facelift surgery. I'm taking care of the platysma, which is this muscle in the neck that causes that turkey waddle. I'm addressing the SMAS layer of the muscle. When I say SMAS, people think it's a big layer of muscle. It's actually this platysma goes all the way up into the face and envelops all of the structures of the fat in our face. So when it starts to descend, it pulls the fat down into the lower face, and that's how you get the jowls. So I have to get into that, and it's more like a mix of fat, fibrous tissue, and muscle. And so that fibrous tissue is a connection all the way to the skin. So when I lift it through a deep plane facelift, that's what I'm lifting. I'm able to lift the fat and the skin all in one move. That's why I do that technique when I do a facelift. But that's important to know, because even though I've lifted it, there's still looseness of the attachments in between the layers. And those this is what is going to be my next, sorry, before I get there. The fascia is built of collagen, and that starts to get thin. They're like ladders that go from the deep layers up to the skin, and that's what gets thinned out. So that's where you start seeing lines and folds in your face. There's also changes in the bone. The bone starts to thin. Unfortunately, there's nothing we can do, surgery or non-surgery, that's going to replace the bone. The only thing we can do is to talk about what we're doing with our muscles. So we make sure we go see the dentist. Don't lose volume in our teeth, because that's going to start to thin the mandible. You're going to lose volume also in your cheeks. So that's a different talk in itself, but that's not related to anything I could do with surgery on my end. So during surgery, what do I see? I see all of these. I don't know if you can see this here. These are what we call septae, fiber septae, and then there's ligaments that attach the overlying skin and muscle to the bone underneath. And I have to release those, because what happens is they start to not be so close. They start to pull away and thin down, and then they sag. So now I have to find them down here. They sag. I have to release them, and I have to lift them back to a new spot. And in that course, that's why it's important that we address collagen at all these different layers. So I'll talk about what I suggest for collagen loss. Okay. All right. So you've heard me say collagen, collagen, collagen. Collagen loss is a primary factor for the visible signs of aging. And so I wanted to ask everybody here and poll also people online, are you currently taking collagen supplements? How many people are? Show of hands. I would say about 80% of you are taking collagen. Very good. That means I spread the message. That's good. All right. There's so many forms of collagen online. Are people online on the chat? Somebody responding to there? Okay. So collagen supplementation is something that I thought earlier on, I thought, this doesn't do anything. As a doctor, you go, okay, well, there's no studies that show this. There are now starting to be. But years ago, we said collagen doesn't do anything. How can you guarantee the collagen you're taking in is going to the site that you want it to be, right? But if you think about it, it's like you're shoving into this funnel all this collagen. Your body's trying to produce the collagen. It has to put it into lattice works, this lattice work into your skin and into the tissues. But if you don't have enough of it, you're not going to produce those fibers together. So even though in my mind, I go, okay, well, I guess that could work. I don't have enough studies to show it. What happened was, and this is a fluke, I was purchasing fish oil from a certain company. They sent me the wrong supplement. They sent me collagen powder instead. And I was like, oh, okay, whatever. I'll just try it. I started taking it, and then I was like, well, my skin is getting better. My hair's getting thicker. So that was when I said, okay, you know what? Even though there's not enough studies, it doesn't hurt to keep taking it. So I had 12, they sent me 12, and it was a good amount. It lasted almost a year. I stuck with it, and I've noticed changes to my skin. Of course, you do want to still do things to stimulate the collagen production. And that's what I'm going to talk about with what you're going to do with skincare, what are you going to do with treatments in the office that we provide here. So, but recent studies, there was a recent study, February 2022. I can't remember the journal, but they did a meta-analysis looking at randomized controlled studies over the last 10 years that looked at the use of oral collagen and topical collagen. And they showed benefits to skin hydration, elasticity, and density. Now, of course, those studies didn't have a lot of numbers, so they need to do more studies to really show this, because you know, it doesn't pay to do this research, of course. That's what happens in medicine. You don't get research unless somebody benefits from it. The drug companies make money because they show the research, they put money behind it. There's got to be something on the back end. Well, collagen is easy to get and doesn't cost that much. And that's why there's not enough studies to show this. But I do think that we should show more of these studies because I think it does work. That being said, there's different sources for it. The one that I have been using is Live Conscious, and I've probably talked to some of you about this particular brand. That's what I got. I used it. It worked for me, but really try out the different brands because, you know, this is a clean source. I would say from this one, it is bovine collagen. So that's coming from cows, grass-fed cows, but you might find a vegan source. If you're vegan or vegetarian, you'll find some other sources available too. All right, the 3 layers of aging that we can control. We can't control the bone, like I said earlier, somewhat we can. First part is the skin. And every aging process, when I say in your 30s, you're going to start to see some skin changes. In your 40s, you're going to start to see both. You'll see skin and fat. In your 50s, that's when you're going to start to see the muscle sagging, causing the jowls, causing the jawline to lose its structure. So I'm going to talk about these 3 layers and how we can control them. So number 1 that I say everybody needs to be on. If you're planning on surgery, not planning on surgery, just doing your maintenance, the first thing you need to know is skincare is essential. So after I have patients doing CO2 laser resurfacing, once it's been a commitment and they've seen the improvement to their skin, I put them on a skincare regimen because we need to maintain so the wrinkles don't continue to settle in. And the benefits of CO2, some of you might have had CO2 laser, but what you'll see is that it improves pigment, it improves the fine lines, and improves texture of the skin. That's the same thing that you're going to notice with skincare. I try to explain that skincare is kind of like your doctor says, eat an apple a day, make the doctor go away. This is something you need to do at home and consistently. What works is if you do it consistently. If you kind of fall off the bandwagon, then you need to come see us to do the heavy duty treatments later, right? So the earlier you start on this and the more consistent you are on it early on, then you'll really see the benefits over years. And I've been doing skincare since I was in my 30s. I wish I started early. Now I push it. If I see a patient and they're coming in, they want Botox and they're in their 20s and I go, really? But start on the skincare. Don't start on Botox first. It really should be skincare first, then Botox. All right. So sunscreen to protect your skin from the sun. Retinol or Retin-A. This is the benefits of Retin-A has had 30 plus years of studies. And what does Retin-A do? It increases exfoliation of the dead skin cell layers on the surface. It improves your fine lines and wrinkles because it stimulates collagen under the skin. It works with vitamin C to do that, and that's why I recommend vitamin C. It also inhibits pigment production from the melanocytes. So that helps to control the pigment in your skin as well. And then improves cell turnover. So that improves the vascularization to the skin. So oftentimes if somebody's planning to have a facelift or a CO2, I put them on a retinol if they haven't been on one yet, because it improves the robustness of my skin. So when I lift the skin heals well. So if you're not on it yet, if you're thinking about it, please get on a retinol or Retin-A. And we can go over what we recommend for you. How else can you slow down the aging in the skin? We know about Botox. How many of you do Botox here?
I have a question.
Sure.
Is that oral?
No, topical. Topical. Yep. But you can do oral too as well. And it's okay if you have too much of it because you're going to pee it out. But good question.
But the topical is better.
Topical is better, yeah. So how else can you slow down the aging in the skin? Botox is going to minimize movement of the muscles that causes those lines to show up in the first place. All the wrinkles in our skin are due to muscle motion. That starts to, so all our lip lines, these smoker lines, they're called smoker lines, but it's really because of our pursing of our lips. That's what creates the lines. Or forehead lines, that's from raising the brows. Our wrinkles between our brows, that's from frowning. So all the muscle movements lead to the lines that we're seeing. So we could slow down the movement, we can help to minimize the motion. However, I'm not a big proponent of Botox around the mouth because it's hard. If you start doing too much, you start looking like you've got no minimal ability to move your mouth. You might slur your speech, you might drool. So those are the things we don't want to see. All right. Next thing is hydrofacial, IPL. These two deal with skin texture, providing hydration to the skin for hydrofacial. IPL photofacial will address sun damage. So it's one of the things that they've shown with some studies that improves DNA damage, so reverses some of the DNA damage from sun damage. And then microneedling and RF microneedling, I'm going to go into more detail on that. So microneedling, show of hands, who has done microneedling here? Gosh, this is so great. A lot of you have done microneedling. I like that. Okay, so microneedling, what is microneedling? Microneedling is microtraumas, I'm going to skip down, uses small needles that we vibrate right through the skin, and it creates little traumas, microtraumas. If you've had it done before, you'll see bleeding at the surface of the skin. Bleeding is good. That's what I get when I do CO2 really well. It's getting into the papillary dermis where the blood vessels are coming up, and that's where collagen is produced. If you don't get deep enough, you don't get that bleeding, then you know you're not getting into the right layer. So it should, if we're doing it correctly, you should see a little bit of bleeding. We usually apply a topical cream because can you imagine if you're getting to the point where you're bleeding, you might feel that part, right? The procedure itself. But the way we apply the topical, we apply it for 30 minutes. And it usually numbs the skin really well. And most of my patients don't say they have any pain with the procedure. It's bearable. So you should create some bleeding, and the natural wound healing in this depth of the skin results in collagen formation. I said it again, collagen. Are you guys counting how many times I'm saying collagen? All right, so this is a video of the microneedling session, just so you could see how it's being done. Oh, shoot. I was supposed to mute that audio. That's PRP. So we're harvesting it from blood, your blood. And then this is filled with platelet-rich plasma, which is chock full of growth factors. That growth factors are then needled into the skin when we do the procedure. Why growth factors? Why are we using PRP? PRP, the growth factors that are in PRP stimulate fibroblasts in the cell to produce collagen. So there's fibroblast growth factors, vascular endothelial growth factor. I'm going to blank out right now. There's a whole slew of them, but you get my drift. There's a lot of growth factors that are important to wound healing, and that's why we use it and we apply it, because we want more robust collagen. There we go. Okay. So a little bit now, the next one is RF microneedling. RF microneedling, what we have in the office is Morpheus 8. There's multiple ones on the market, but if you've heard of the ones on the market, you've probably heard this one the most. And it's because we're seeing the best results from all the RF microneedling devices that are on the market. This one really is a big player. And InMode is here today. So if you want to talk to the rep to see more of their pictures and the results, you can see that from them and you can see the device. So what does RF microneedling do? It's the same concept. We're using those needles, but now we're delivering heat in it. So it's a mini, I call it a mini CO2 laser. It's not as aggressive as a CO2. It's a step down because we're using heat and delivering it through the needles. The needles are very fine, and then we can deliver at different depths. So the surface will be, 1 to 2 millimeters. If we go to 3 or 4, now we're getting into the subcutaneous fat. So we will want to do that in the areas where there's jowls or there's chin fat. So those are the areas where we can contour the face, which we couldn't do with some of the older RF microneedling devices. So this is the one that we love the most because it's tailorable. We can tailor the depth, and that's why I like it. The needles can go to 4 millimeter depth. That's what I was pointing out earlier. Okay. This is a video of the Morpheus treatment. I wish I could show you my video, but I don't want to show you me without makeup. All right.
Does it hurt?
It hurts.
Yeah.
I'm not going to lie because I have low pain tolerance. Susan is a champ. She had me do this procedure on her and she just keep going,
Really?
We do blocks. We also can use Pronox, which is a gas that helps to reduce the pain. We use a topical cream too at the beginning. And when I say blocks, we use anesthesia, local anesthetic, like a lidocaine, and we block out the nerves so that you can't feel it. It is much more comfortable with the blocks.
How many
Would you say?
treatments is that, the after effect?
What was that?
Before and after, how many?
Oh, you can't see it so well. You'll
Three.
have to see it on our
Three?
screen.
Three.
Yes,
Okay.
three treatments.
Some
Yeah.
people have seen it on the first treatment, and then others, your collagen growth takes time to build up. And so most of the time we see it after the second and third treatment the most, because you're talking 8 to 10 weeks.
How often do you do the treatments?
We do a series, and we usually take it in 4 to 6 weeks,
Mhm.
in between the 1, 2, and 3.
And how far down the neck can you go?
How far down? All the way down to the chest. We could do the chest even. Yeah.
And how long do the results last?
Well, so that's a tough question to answer because aging always continues, remember? So what I usually recommend is if we do the treatment, we do 3, and then we do a maintenance once a year. So you're not going to do 3 every year. You're just going to do 1 then from then on once a year. Okay.
So, can you do 2 days after each treatment?
Not for the first maybe 2 to 3 days. You're not going to want to.
But then you can.
Then you could put makeup after. Yeah. Once the holes have closed up. Okay, so we're done with that. Next one. So we talked about skin. Now the next layer is the fat volume loss, right? So the fat now is starting to descend and it's starting to lose the amount of fat that we have in the face. So what can we do for that? Short of surgery, today is not here for surgery, but short of surgery is to replace that volume. So we want to put volume in the right places. We said fat descends from our cheeks and goes to the lower face. So we want to put volume in the upper face, in the upper cheeks, in the temples, under the eyes where you might have hollowing, but not in the folds. And I'll explain a little bit in just a bit here. Then Sculptra is the other filler that I love to use. And I'll explain a little bit more about why I like Sculptra. Fat grafting is available, although I just did a surgery on Tuesday that had fat grafts that was very difficult for me to get into the planes because it gets all over the place. So I'll explain to you why fat grafting I would hold for after surgery or during surgery. And then the facelift. So surgery, I want to explain to you what I see when I get into the face. If you see, where this picture is just to mark out a couple things. The folds, the nasolabial folds, are typically what people want to address. They don't like her folds. They don't like the marionette lines. They don't like the jowls. So people will go ahead and try to inject in front of the jowl to hide it. But this is the direction of the facelift. It's pulling on this area. And when I have fillers in this area, it acts as a block. So the lift is not as good. So you have to imagine if there's volume there and I'm trying to pull up against it, I won't be able to lift because I have to release all the attachments. I have to release what's holding me back. So hence, I'm not a fan of fillers in this area. That doesn't mean fillers don't have a place. Fillers do have a place, but I usually place it higher in the face. And Susan and Jocelyn are well aware of that. So if you ever talk to them, they'll say, oh, we need to inject it up in cheeks. And you're like, but I want to inject it here. But they're trying to guide you in the right way because it's not because we have loss of volume that we get these folds. It's because the fat has descended and creates those folds. And that's why we're trying to lift. We're trying to put the volume up higher. All right. So X marks the spot where you don't want filler. Okay. Where is filler okay? So I'm going to point out to you where I'm okay with using filler. Around the eyes, because volume is descending away from the eyes. So it starts to get sunken. So you want to place volume there. And it doesn't affect the facelift up to a certain point. If there's too much filler there, it can swell after a facelift. But the other area would be if I'm lifting, if I'm doing the nose. So sometimes I have a non-surgical rhino that somebody asked me to do the filler there. Another area would be the lips, or to raise the border of the lips. or to address the chin if we have chin volume loss on a weak chin, or the cheeks, okay? But nowhere do you see in the areas where I'm not putting are the areas I would say don't put filler, because it will make your face look square and heavy. Okay. The other thing I want to point out for surgery is when I'm seeing these ligaments like I was telling you about, here are the where I would avoid fillers in the lower face and treatments that might create scarring near the SMAS muscle. So if you see, this is the skin, then we have fat, then we have the muscle, then we have these attachments to the underlying deeper muscle, and then the bone. So when you have anything that's done superficially right under the skin, so that's what Morpheus does, you're okay. But as you start to get deeper and deeper, you're going to cause scarring in this muscle. So one procedure that I do here, but I'm not recommending before surgery, if you're considering surgery, is face tight. I usually use face tight after surgery, but not before surgery, because it will place collagen in certain areas that, now that's not to say that it's wrong. It's just that if a patient had a choice and they're telling me they're going to do a facelift down the road, then face tight might limit what I do, because now I'm going to have to release the scar that's right near the muscle to work on the muscle. Okay. Ulthera, I've never had great results with Ulthera when I have to do a facelift. Then it takes my time in surgery longer because I have to release all of the scar. And Ulthera goes deeper than face tight. So I actually don't like Ulthera more than face tight even, because now under the muscle, I will see some scarring sometimes. Thread lifts are a no-no as well. I don't know if anybody's tried thread lifts or heard of thread lifts, but again, it's right under the skin. And so if we're going to lift the skin for a facelift, it's in my way, causes scarring. And then Thermage or Thermi RF, and Renuvion is another one, which is also called J plasma. So all these devices are non-surgical devices. They're okay for after, but I would never do them before surgery if you were planning to have surgery down the road. If you said, I'm never going to have surgery, I'm too chicken for surgery, then okay, then we can talk about it. All right. So here's some of my notes from a plastic surgeon about where is good to place filler. Can you guys spot where the filler is poorly placed? So Madonna here, you can see where she looked like when she was younger. Her volume looked like an upside down heart, right? Upside down triangle. So you had more volume up top, less volume down below. Now she has a pretty wide chin, and her cheek, they're trying to mimic youth, but it's overdone. So everything is in moderation. You can't lift as much with fillers. You can do up to a certain extent, but remember we said collagen is being lost, so things are still sagging. So if somebody tells you they can lift with fillers, that's a no-no. I mean, early on, maybe in your 40s, yes, but as you get into your 50s and 60s, you're going to need to use a lot of filler to lift, and then you're going to look overdone. Then you can see this is Meg Ryan, and that's where the fillers went. Jawline doesn't look good. So I don't like to inject in this area because it widens the chin. It obliterates that jawline. Okay, so properties that are ideal for an ideal filler to combat aging. I'm going to talk about Sculptra now. It is because Sculptra stimulates collagen that I love it so much. And I've operated on faces that have had Sculptra and I've had no problems with it. When I've had filler, I do see it in my way. It doesn't disrupt it if it's in the cheeks, but it does disrupt if I'm in the lower face. So I will dissolve filler before any surgery if it's down in the lower face. But Sculptra, I can leave where it's at. And typically, if I'm injecting it, I know where it's at. It's typically in the upper face if we're going to inject it, and I usually work around it, and I have no problem with it. It does stimulate collagen. It's long lasting because it stimulates collagen. Because your own collagen should last you anywhere between 2 to 5 years. Now, I can't say that Sculptra lasts 2 to 5 years. All of their studies have shown they stopped at 25 months. At 25 months, 80% of patients, 85% of patients were still happy with their results. So that tells you the longevity of it. They stopped it because they had no more funding. They could have gone further, but that was enough to show that the results last. And the other part of it is it's natural looking, because you'll see as I show you the pictures, it looks very natural. It looks like you just revolumize the face with fat. It's a polylactic acid filler, so it is a man-made material. So some people hear that and they go, oh, are you going to have a reaction to it? You can. There's a 1% chance of a granuloma. I've only had one in my hands. Most important is to be massaging following directions after the treatment. So after we do this treatment, you have to do a homework at home, which is massaging your face 5 times a day for 5 minutes each time. Some people are shaking their heads. They remember me telling them for 5 days, okay? It is only one of 2 biostimulatory fillers on the market. So there's Radiesse and then there's Sculptra. Actually, there's Artefill too, but that one is more permanent. There's Bellafill and Artefill. So it's long lasting and it gives you natural results. Again, results can last up to 2 years. We don't ever say how long it can last. We know it lasts long, but the studies stopped at 25 months. And here was the improvement. So we said 80% were satisfied at 25 months. Okay. So it's good for the cheeks, the temples, the deep lines or folds due to volume loss. I didn't say here, but I say folds in the cheeks. So some people have these folds or pleats in the cheeks because they've lost a buccal fat. Now that would be one area I might place it. But otherwise it's upper face. And then the other thing that I like to say is usually the rule of thumb is about 1 vial per decade. Usually I go a vial less than a vial per decade. And usually I'm able to get good enough results with that. Oh, dear God. Oh my God, I didn't know what music was with this. So we know who this patient is. And this is what I'm showing you is doing an injection. And you see she's just sort of blinking, but she doesn't have much pain from this. There's a numbing medicine that's placed with the filler. So as it's placed, it just revolumized. Most of this is water. So the filler has to be reconstituted in water. And I mix it ahead of time 1 week in advance. So it's customized for each patient. And then let me get to the end so you could see the result. So here are some of my own results. This is a patient, you could see softened her face, placement upper face, not lower face. And you could see the improvement to the face overall. I think it's harder to see on this screen. You probably see it better on my screen. And then here's another one, again, hard to see, but volume loss and the improvement in the volume loss, very subtle improvement that you could see. Okay. So what should you expect with Sculptra? It's injections over several sessions. It's 6 weeks between injections. I do a vial per session. It's very slow, means, you know, when I do this, I do 1 vial, and then 6 weeks later, I do another vial, and then 6 weeks later, I do another vial. So you're seeing me for like 3 months until we get to the final result. But I like this because nobody ever says, somebody told me they saw, like, did you have filler? They usually get this comment, oh, you look good, but they can't put their finger on it because it looks so subtle. And then the results build up over months. And the average that I usually do is about 3 to 4 vials per patient. So now this is the last layer that I want to talk about, which is fat or muscle that's causing sagging in the face. As we lose collagen in the SMAS layer, as we lose the thickness of that layer, what are we going to have as available to use as treatments? We need to stimulate collagen deeper. And if you're not doing a facelift, so you can see facelift, neck lift, brow lift, I'm putting all these surgery because it's very hard to get that deep and do something to tighten it. I'm not a fan of thread lifts, as I said. People will use it to get that deep sometimes, but it's not the best option because it will leave scarring there and I have to release it. But what I do recommend, because RF microneedling can be tailored, we don't want it in all the layers. We want to address it for the jowls. So I will melt jowls. I will melt chin fat. I will melt wherever there's pockets of fat. Sometimes in the superior jowl fat, some people have this pocket right near the corner of their mouth. If they have that, that's also a good place to do Morpheus. And then the next one is face type. As I talked about earlier, it's directed a little bit deeper. It's in between the skin, the fat, and the SMAS muscle that I'm lifting. It does not go below the SMAS muscle though. So it can create scarring between the SMAS and the upper skin. So it's a problem in the outside of the face. In this area, I don't go deep enough, so then it doesn't prevent me from doing a facelift down the road if I need to. So here's our F microneedling results. This is our, Susan, can you see it? I wish we had a better screen. This is very hard to see on this, and I'd have to just show you what we have here or in our gallery. This is another example of face type procedure and the result we were able to get. It also melts fat, but you can see the smoothing of the jawline where she had some jowls under the jawline. So early jowls I can address with face type. If it is more sagging, I have to test that. So the skin quality is important for face type. I have to test if I can lift it, and if I let it go, there's not a good bounce back and it's very loose and I'm pinching a lot of skin, then that's not a good candidate for face type. All right. So here's the question I get. I'm not ready for surgery. What should I do? All right. So in your 30s, that would be skincare, 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 skincare for everybody, and Botox, and then perhaps Morpheus if you're trying to stimulate collagen. In your 40s, now you're starting to see volume loss. It's going to be use of fillers and sculpture and skincare. So all of this applies still. And then in your 50s, that you're starting to see more sagging, what's available? Morpheus combined with everything that I've talked about already. And so the best results that I see are usually a combination. Doing one treatment alone or doing a series of just microneedling without anything else, not doing any skincare, is not going to get great results. You really have to stack multiple types of treatments to hit every layer if you're going to see a result when you get older. So tackling each layer by stacking is the way I recommend it. It's kind of like when I do a facelift. When I do a facelift, if somebody has volume loss, I'm going to do a facelift with volume, and maybe their brows are dropping too. I'll do the brow lift, and then their lip starts to get longer. I do a lip lift. So combining all that gives a better result than just doing a facelift alone. So stacking treatments is the way to go. And the best combination I like to do as a surgeon is a facelift and a CO2 together, because it addresses the skin and the deeper layer underneath. So both layers. The things I would avoid is fillers in the lower face again, treatments that we said may create scarring, and then treatments that dissolve fat in the upper face. So no dissolving of any fat, no Kybella. I'm not a big fan of Kybella as well, because we have better options for addressing the fat. And last part I want to talk about is how do I maintain my results after surgery? Some of you are here and have had surgery, have already had surgery, or maybe you've had face type, or maybe you've had Morpheus. Like, what else can you be doing? So these are the things I'm going to start addressing. Is now you can start adding face type, the sculptra, fat grafting, CO2 laser resurfacing for the skin. If you've already done Morpheus and you've kind of reached a plateau, then the next step is the CO2 laser. It's a bigger commitment, more downtime, but you're going to see more results on the skin. And again, aging never stops. So collagen, collagen, collagen. And how do you slow down the aging process? We talked about skincare, combining it with microneedling or RF microneedling. Botox never stops, HA fillers, and sculpture. So the more aging changes you see, the more you have to combine to get the best results. All right. How many times did I use the word collagen? Did anybody count? There's a raffle prize. Oh, shoot.
20, 12, 15, 9.
We'll talk about the raffle prizes here soon. I was just joking. I just wanted to see. Are there any questions tonight about what I just talked about today? Yes.
What if you have rosacea? How can you use
the retinol?
That's a good question. Retinol in our line has an emollient, so it's less abrasive than some of the retinols you might find. Retin A cream would probably be a no-no for any rosacea. And if you're gonna deal with rosacea, there are certain areas where rosacea is more prominent. So certain areas of the face. So you could skip those areas and just treat the other areas that are not affected by rosacea. So that'd be one way.
Can your retinol 100 be used on your face every evening, every day? Is it too dry?
If you can tolerate it. Not everybody can tolerate it. So I use retinol 100 every night, but I wouldn't start off on that. So you would work your way up. It's kind of like exercising. You have to like slowly get into it. And then once you build up stamina, you can do more and more. So I wouldn't start off with retinol 100, but maybe start off with retinol 50 and then do it every other night and then go to every night. And then once you're able to tolerate that, go up to retinol 100. Yeah.
Should you put retinol on the neck as well?
That's a great question. I do. Now, I use it majority on the face, and then whatever I have left, I spread it onto the neck. So don't forget your neck. Don't forget your neck. Susan knows. Okay. Can somebody plug in the Mac? It's low battery.
What, another question?
Yes.
So I put the retinol on, then you put a layer of the vitamin C on top.
That's a good question. Vitamin C, I usually do in the morning.
I see.
Yeah, because it will irritate your skin if you try to do both at the same time. Typically, because vitamin C, the serum is with ferulic acid, so it becomes intolerable if you have dry skin. There's another one in our line called vitamin C green E tea gel, and that one can be used, but it's can we get the plug in? The green tea gel, and that one is for dry skin or patients who have rosacea. So if you have rosacea, that's a good one. The C and E green tea gel, because it has an antioxidant. Yeah.
Say you get a facelift or a neck and lower facelift at 58. Are you expecting to have to get another one at 68 and then at 78? Like, how does that work?
I cannot answer that question because it's individual based.
Yeah.
And one of the things that you have to realize is that that's a great question. And this is what I talk about when I have a consultation with anybody. I usually say, when you do your facelift, you're going to want to maintain the results. So that means if you did it at 58, but you did nothing, you might last only 6 years. You might last 8 years. If you do it at 58 and then you've done everything right, you have the genetics to back you up, you've maintained your weight, you haven't gained any weight, you haven't lost any weight, you've been stable, you protect your skin from the sun, you always wear sunscreen, you always do your retin A, and you take care of your body. That means like getting good sleep, getting good hydration, not getting too much stress. I mean, how many of us can say that? So there's a lot of things, there's a lot of factors involved, but you want to control as many of those as you can. And then can you say, yes, you can safely guarantee that there's no true guarantee, but as much as you can control, you should be able to see longer lasting results the earlier you get anything done. So if you get a facelift in your 40s, you might see it last. You'll hear patients say, and I hear it all the time, I had my first facelift in my 40s, and I really didn't think about anything until I was 60. So the earlier you get the surgery done, also the better, because the skin quality is better. Yeah.
So with everything that you've talked about today,
Yes.
is there any time to get out of the house in between all of these things? To live our life? And
Yes.
in between all of taking care
Well,
of everything?
so hence that's why I love some of the stacking procedures that we do. So when I say stacking, I will do a Morpheus and a microneedling and Sculptra. I can do all of that in one day. So I prefer to do as much as possible, because just like if you were to have a facelift, you'd say, well, what else can I do at the same time? I want the same downtime. I don't want to have to come back and do my eyelids in another 2 months or something like that, and I have to take more downtime. Same thing with non-surgical treatments. We can stack all of them at once. So if I'm going to do Sculptra, I prefer to do Sculptra with Morpheus at the same time, because Morpheus is going to stimulate collagen on the top and Sculptra is going to stimulate collagen deeper. So you're going to get both.
So you have less downtime. but
Yes.
When you're good, you can get out and run around and have.
Yes, correct.
Okay.
And then 6 weeks later, we say, okay, now it's time for you to come back. We do that again. All right.
Added the 2 days which you talked about. It
Yeah.
is not a long downtime.
Oh, okay,
Yeah.
yeah, that's sort of where my question is.
Yeah, I went out that same night
Uh,
after my Morpheus treatment. Yeah.
It's mostly being in the sun
Yeah.
and making sure you wait a few days before you put sunscreen on to go out and sun. Mostly.
Right, I just want to spend my whole life in downtime. you know, thank you.
Most of these have a low.
Do you want to share your
No,
experience,
yeah,
Elizabeth?
I was fine after Morpheus, but probably the next day, no one knew any different. I didn't put makeup on, but it wasn't like a severe, I didn't look severe, like something had happened.
Yeah.
So,
You're not going to say that with the CO2 laser. You're going to hide for 10 days.
For what you're gonna hide for 10 days?
CO2 laser.
CO2, I've heard that, I'm not done, but I've heard that. yeah.
Women of color can't do CO2 laser.
No. Hence, Morpheus is perfect for you.
Yeah.
Yeah, it's perfect for Asian skin. Yeah. Another question? Yeah.
Yeah, so if you want to do something for marionette lines,
Mhm.
jowls, and you're thinking you're not gonna have a facelift in the future.
Mhm.
At 58,
Mhm.
what would be your recommended process there?
So we talked about fillers not in these areas if you were planning to have a facelift down the road. So that's where it's okay to have fillers. If you go, you know what, I know for myself, I will never have a facelift, then that's okay to have fillers in that area. But you're going to want to add all other things. Like we said, there's multiple areas of aging. So you're going to want to address the skin at the same time, put fillers, and possibly do Morpheus to tighten. So you got all layers.
So if you get the fillers, is that one of those times though where you risk it then dropping down and
No, so what I would do with that is we typically do the treatments of Morpheus first, and then we put the fillers after. So after the tightening has been done and everything's taut, then you could put the volume in. Yeah, because Morpheus will melt filler as well, because filler's right under the skin. So the Morpheus will melt it. So we usually wait until after. That was just a great question, though. You kind of primed me for this, huh? Any other questions? Any questions on online? We have I think it ended because it's ended at 5, so it stopped. I don't know if you could check that, but all right. So what I'd like to do now is just go over the promotions and then go over the raffle prices. So everybody knows what's available. Okay. So we talked about hydrofacial. There's a set of hydrofacial treatments. It's 3 treatments, right? So there's a package there. There's an IPL series. I usually recommend 1 IPL per decade per year. So if you're in your 40s, I would recommend 4 treatments in a year. So you'd space it apart through the year. Skin pen microneedling, we have a series of 3 and a series of 6, I believe, 3 and 6. So 2 different packages, one for the face and neck. Then there's Morpheus. Morpheus, we have a series of 3, not the single treatments, but a series of 3, and it's for the face and neck. All of the treatments, so the skin pen and the Morpheus are with PRP. Then we have, for the other packages, we have Botox, Dysport, and Juvo. They're in units, so 50 units for Botox and Juvo, and Dysport 150 units. Filler packages, we have 2 and 3 syringe combos, so it just depends on where you're getting it done. You can always come talk to me, Jocelyn, or Susan to figure out how many syringes we might suggest. Sculptra is 3 to 4 vials. There's a 3 vial package that you would get Dysport for free, and the 4 vial package you get 1 syringe of Restylane filler for free. Then we've got a Morpheus and HA filler combo, like we were talking about earlier for marionette lines. And that would be done with our nurse or nurse practitioner, Susan or Jocelyn. And then there's a full facial rejuvenation package with myself. And that would be Sculptra, Morpheus, skincare kit. And then there's a post-care skincare essentials that has the retin-A and everything as well. Okay. So that's a full big package. All our skincare is 20% off until Monday at midnight. And also, if you're thinking about giving any gift cards for the holidays, if you're giving mood, there's a 10% bonus value. And I know this is a big, this is very popular because every year we have a whole bunch of people getting gift cards for themselves because they're not sure what they want. So we just give gift cards. But you get it instead of a 10% off, it will be a 10% bonus. So for $100, it will be 110 value. If it's 200, it's 220 value. Okay. All right. And then this is the details about where you could get the promotions. It's facesbydrt.shop. If you can't make up your decision tonight, you have this weekend to mull it over. And here's our raffles. So 1 ticket for attending tonight. We're going to take those tickets and put it in our bowl. We've got 1 ticket per $100 spent on promotions. And then the raffle prize winners will be announced via Instagram Live at 4 o'clock. So tune in. It will also be saved. So if it's on live, it doesn't necessarily mean that you have to show up at that time. You'll still see it on our feed. And then follow us, of course, on Facebook and Instagram. We also have a YouTube channel because this is going to go on to our YouTube channel. So our first prize is going to be 4 winners are going to get this collagen peptides. There's also our skincare essentials kit. There'll be 2 winners, and it's 3 products: a sunscreen, a vitamin A product, so it'll be a retinol or retin-A, and we'll determine what works for your skin, as well as a vitamin C product, and we'll determine what works for your skin. Juvo, there will be 4 winners of 25 units. Dysport, 4 winners, 75 units. And Botox, 4 winners, 25 units each. We'll also have 2 winners for Restylane product of fillers. So we'll determine which one works for you. And Sculptra will have 1 winner for that. We have microneedling, 3 winners, 1 treatment each. And our Morpheus is our grand prize winner. And that value, can you explain what the value is for that? $1,500. Yeah. So that's 1 winner. All right. Follow us at Faces by DRT for our YouTube and Instagram and Facebook channels. And thank you to Galderma. Please visit with all of them: Galderma, Evolus, InMode, Crown Labs, and Allergan tonight. Do you have anything else? That's it? Okay. All right. Do you